Hi, and thanks for tuning in for today's Butte County COVID vaccination update. I'm Lisa Almaguer, and today is Thursday, February 4th. So today I have some good news to share with you about progress made in Butte County, clarification about the vaccine notification process, public concerns about getting the second dose, and new information about scheduling vaccine appointments. And finally, we'll do a question and answer session at the end. So we have a lot to cover today. Let's start with the good news. So for many, it may feel like getting the vaccine is near impossible and it just isn't happening fast enough. I get that. We have to remember that this is the first pandemic in 100 years. So here's the good news and the reality of how well Butte County is actually doing. Since we've been receiving the vaccines or receiving allocations, you might hear that word, which has been about a month, we have worked with local hospitals and pharmacies to get over 29,400 doses administered. This places Butte County in the top 10 counties in California to get the vaccine out to residents. Another way of saying this is out of the 58 counties in California, we are getting more doses to our residents than 48 of those counties. I'm going to share my screen with you very quickly to show you a graphic from the LA Times. Okay, so this is the LA Times website, and the graphic here is vaccinations by county. And the darker the color green, the more doses going out to residents in that county. So you can see Butte County right here, and actually they don't even have the most up to date. They're showing almost 28,000 doses administered. And as I just mentioned, we're at 29,400, and this is 12,224.2 doses per 100,000 residents. If I scroll down, it also shows you by county. So Mono County is in the number one position for getting the most doses to the residents, and then it goes in order. We're actually number 8 out of the top 10 counties. So it shows you doses administered and per 100,000 residents. So I just thought that was something really positive to share with you, and wanted to give you this good news. So I'm gonna come back to you here. And let's talk about the announcement that we made earlier this week about moving forward, that we would not be taking more signups for the vaccine eligibility notification email system. So this is in part due to the fact that we now have online self-scheduling available, and the notification is not required to sign up. It also creates an extra step for people. So for those who've already signed up, it's fine, but moving forward, we didn't want to have to create an extra step for the public. So I want to address some concerns that I heard from the public during this change, and maybe the feeling like we were changing the rules on some people, which we are not. So residents who previously signed up before February 2nd will still receive an email notification. If you signed up for the notification, but you learn about the vaccine or a vaccine clinic that you qualify for. So for example, if you're 65 or older and you hear that we have opened up spots for a clinic, you may book your appointment and you don't have to wait to receive the email notification. As a reminder, the notification system was never a wait list or a priority list. The intent was simply to notify you when your group was eligible to get the vaccine. We also stated early on that we would make all people aware about vaccine clinics on our website, through the local media, and on social media for those who did not sign up for the email notification. Not everyone has an email, so it didn't work for all people. And then lastly, the current age group of 65 and plus who's now eligible for the vaccine. This is a very large group. We have, I believe, over 40,000 people in this group. So we are sending out email notifications to those who've signed up in phases. We can't send out an email notification to all 40,000. So you'll eventually receive an email if you previously signed up for the notification, and it is on a first come, first serve basis, and that applies to those who are currently eligible in the priority group to get the vaccine. So now let's talk about getting the second dose vaccination. I'm seeing anxiety grow among residents who've received their first dose and are now concerned that they might not be able to get their second dose. And I really want to bring this anxiety down and give you some information that I think will help. Our second dose allocations are guaranteed. So every first dose that the state allocates to Butte County, they guarantee our second dose. So if you've received your first dose, you will get your second dose. The other concern that I'm hearing is, what if I don't get my second dose exactly 28 or 21 days, Pfizer, Moderna, it just depends on which vaccine you received, out from my first vaccine. So there is updated guidance from the CDC that allows for second dose administration up to 6 weeks or 42 days after the first, if it's not feasible to adhere to the recommended interval of the 21 or 28 days. And also know that the first dose does not expire. So even if you get your second dose a bit later, you don't have to repeat the whole course over again. And then in regards to where will you get it, how will you know, it really at this point depends on where you received your first dose. If you received your first dose from Oroville Hospital, they are scheduling people for their second dose during that first dose appointment. If you received your first dose at Enloe Hospital, you will just need to pay attention to when we announce second dose vaccination clinics, and then you'll just go online and schedule yourself for your second dose, or if you need to call and schedule that appointment, you can do that as well. Your vaccination card will have the date that you received your first dose, and so you can calculate out either 21 or 28 days from there for your second dose. And like I mentioned, the CDC says it's okay to wait 42 days. So there's a larger window. So let's see here. Like I said, we have a lot to cover today. So before we jump into the Q&A section, I want to address some of the technology challenges that the call center and the vaccine scheduling hotline have experienced this week. So due to a large volume of calls coming in, we had over 300 in the first 15 minutes the other day. So a lot of calls. It has overloaded our system several times. Please know that if you need to call in to book your appointment, you may need to call several times throughout the day before you get in. We wish this wasn't the case, and we have our computer and IT folks working on this and trying to even bring in more people, but it's just going to require more calling throughout the day to get in, depending on the volume. So another important piece is when calling this number, callers will hear one ringtone, and then the call will go to hold music. This means that your call is actually being transferred to a call taker. So we play that music instead of having you hear multiple ringing. So just know that hearing the music is a good sign, and that means that your call is actually getting moved along to a call taker. And then lastly, if you have internet access, we encourage you to book your appointments on the Butte County Public Health COVID vaccination website. It's super easy, it's super fast, and this will help to reduce the number of calls coming in and to save those lines for people who do not have internet. So we thank you for that, and it will be quicker. So if you have internet, why spend the time calling all day to get in? So we will move into the question and answer session. And as always, starting this Monday of this week, we have been accepting public questions, and we put together answers to those. And so I'm going to share my screen again. I'm going to show you a PowerPoint with the question and answers. Okay, so again, today is Thursday, February 4th, and these are questions and answers from the public. So the first one is, how will people who had their first vaccine get their second dose? We talked a lot about this, so it really depends on where you received your first dose. But the big important takeaway from this is just keep keep watching the media, keep coming to the public health vaccine website. If you're on Facebook, check that out too. We will make announcements when second dose clinics are available. I completed the registration link on your website, but I have not been notified. What should I do? So residents who've previously registered will continue to receive an email notification. We talked more in depth about this, and you'll receive this when you're eligible, and we're sending those out in groups. So it might take some time, but you will get that email. Calling the COVID call center will not get you an appointment sooner. If I call the COVID-19 call center, can they schedule my appointment? No, the COVID call center cannot schedule your appointment. Only the vaccine scheduling hotline can, and they can only do that when we have new clinics available that have slots to fill. Once those slots fill, that hotline is shut down until another clinic is open. So a bit of information that we've just learned literally this morning is the state has announced more changes for local health departments coming soon. They will soon require the use of their scheduling platform called MyTurn for booking vaccine appointments. Once this goes into effect, Butte County Public Health will have to change from the current online scheduling system to MyTurn. So just some things that are coming down the line. I see the link on your website to schedule my vaccine, but all the slots are full. What should I do? If all the slots are full, we ask that you continue to be patient. This means that there are no further slots for that clinic, and there is not an appointment for you to book. We can only schedule clinics if we have doses of the vaccine to offer. So clinics are announced as soon as they are scheduled by the vaccine providers, which are Enloe, Orchard, or Oroville hospitals. And Butte County Public Health announces these open clinics, as I mentioned, through the local news, on social media, and on our COVID vaccine website. How often are you going to announce clinics and when? At this time, we do not have a timeline. Scheduling clinics depends on how many doses the state allocates to Butte County each week. And again, we'll announce these through the media, on our website, and on social media. I have underlying conditions. Why am I not being prioritized for the vaccine sooner? Butte County Public Health continues to follow the state's vaccine guidelines, which only prioritizes by age and not by health conditions at this time. There's been discussion from the state about changes to the state's prioritization, but no official announcements or changes have been made by the state. How many vaccine doses have been administered, and how many are you administering per week? So you can find this information on the COVID-19 dashboard. There is a link to the dashboard on the primary or the main Butte County Public Health COVID-19 homepage. And as I mentioned before, 29,400 is our number as of today. So a lot of residents so far. What is the timeline for childcare and agricultural workers to be vaccinated? How quickly we move through the tiers is based on vaccine supply, which we cannot predict. And again, we don't have a timeline. We currently are in the 65 plus category, which is over 40,000 people. The state expects to have enough supply to vaccinate most Californians, including Butte County residents, by summer 2021. When will those with pre-existing conditions be prioritized? We touched on this a little bit. While there has been discussion in the media about changes to the state's prioritization, no official change has been made. Who will be prioritized after the current phase 1B Tier 1? We honestly don't know. Until announcements are made and information is provided by the state, Butte County Public Health will continue to follow the state's phased approach. As soon as it's changed, we will make necessary changes in our approach and make public announcements. Is the slow rollout due to the lack of vaccine doses or issues with administering doses? Well, as I mentioned before, we're actually not so slow. So it might feel like a slow rollout, but we are very proud of the progress that we have made in Butte County. If the county is allocated doses, then we immediately make plans and open clinics, so those doses get administered as soon as possible. So definitely not an issue of getting them administered. In about a month, we have administered, and of course, this is already outdated, over 29,400 doses, which places us in the top 10 counties in California to get the vaccine out. Eventually, everyone in Butte County who wants a vaccine will be vaccinated. Okay, so if you have made it this far, you are an information long hauler. Thank you so much for sticking with me. I did have one little data point that I wanted to share, and I meant to share it earlier. We have had 6,000 people who have completed the vaccination series. So that means 6,000 who have received their first and second dose. So again, for those people who are concerned about the second dose, you will get it, and we already have people who are completing that cycle. So just some closing reminders: the vaccine is still highly prioritized for people in phase 1B tier 1, currently the 65 and older group. And as more clinics open, we will make everyone aware through the local media, on our website, and on social media. And so, the vaccine is important. It can protect you, your family. It can help us get back to normal and out of this pandemic. So I encourage everyone to register when your place in line is ready. So as always, stay safe. I'll talk to you soon.